Health policies aim at improving overall health outcomes and reducing health inequalities for the entire population through individual or collective health-related intervention. To tackle challenges of our time, such as increased population aging, heavy burden of chronic diseases, growing inequalities in health, uprising pressure from health expenditures, social expectations for better health conditions. Health policies are experiencing a shift from disease-centered to active health-oriented. We can discern this shift from both health policy research and health policy making that pay greater attention to those challenges in general and chronic conditions and health inequalities in particular. 5 major themes emerged from the reviewed articles on health policy system. In our discussion of major themes, a series of abbreviations are used. Patient-centered care, patient activation, integrated care, community-based care, social determinants of health, lifestyle determinants of health, and World Health Organization. Patient-centered care focuses on taking individuals', families', and communities' perspectives and is determined by the quality of interactions between patients and clinicians through which health system performance could be improved. Thus, patient-centered care emphasizes the role that patients play in high-quality patient care, and the patient role is now treated as an important dimension in care systems. Growing evidence shows that patient-centered care improves disease outcomes and quality of life and provides more efficient care and improved population health. Patient activation is defined as understanding one's own role in the care process and having the knowledge, skills, and confidence to take on that role. Patient activation involves 4 stages. First, believing the patient role is important. Second, having the confidence and knowledge necessary to take action. Third, actually taking action to maintain and improve one's health. Fourth, staying the course even under stress. Increased evidence showed that patient activation is associated with higher self-management behaviors, higher quality of life scores, and lower patient care costs. According to World Health Organization, integrated care should be centered on the needs of individuals, their families, and communities. Integrated care was proposed to address care fragmentation in healthcare delivery because integrated care can bridge the boundaries between professions, providers and institutions, thus better support the rising number of people with chronic health problems. Key elements of integrated care include policies on improved collection and sharing of information, moving care into the community and aligning payment schemes to incentivize care coordination and enhance integration of provision of services. Community-based care is the rebalance of health systems from institution-based to community-based. Scholars believe that community-based care could improve care in the community through strengthened primary care as well as strengthened community-based care. It is characterized by the use of epidemiology and clinical skills to depict the health needs of the community, assuming responsibility for a defined population, clear defined programs to address communities' health needs, community involvement, and accessibility to services. In order to tackle health inequalities, social determinants of health such as income, wealth, and education, etc. have been highlighted and viewed in the literature as causes of inequalities. Growing scientific evidence from promising interventions focused on social determinants of health, such as education and early childhood intervention, urban planning and community development, housing, income enhancements and supplements, and employment has been proved to be able to improve population health and reduce health disparities. Scholars and policymakers have proposed that some social factors such as taxation and tax credits, old age pensions, sickness or rehabilitation benefits, maternity or child benefits, unemployment benefits, housing policies, labor markets, communities, and care facilities are necessary social determinants of health. Lifestyle determinants of health focus on changes in individual behavior and lifestyle. It includes safe sexual behavior and reproductive health, physical activity, eating habits, and safe food, as well as reductions in tobacco and alcohol consumption, drug use, and excessive gambling. Research findings suggest that lifestyle behaviors are important in addressing diseases such as obesity, diabetes, cardiovascular disease, and even mortality. Accordingly, extensive literature focused on the evaluation of public health policies that may produce and keep healthy lifestyle or change unhealthy lifestyle. Public interventions mainly involve the following policies on lifestyle determinants of health: policies on tobacco control, policies on alcohol, sugar-sweetened beverage, food and nutrition, and promoting physical activity. Built upon our findings of major themes in the literature, we constructed a framework on active health governance. We define active health governance as health policy and administration that adopts whole-of-government and whole-of-society approach to link all health-influencing factors, and provides targeted interventions according to people's critical life stages, in order to achieve equitable and better health outcomes. This conceptual framework on active health governance that we propose is composed of 4 elements, 3 approaches, and 2 outcomes. The first element of the framework is governance for health. Governance for health was defined as the attempts of governments or other actors to steer communities, countries, or groups of countries in the pursuit of health as integral to well-being through both whole-of-government and whole-of-society approaches. The whole-of-government approach is an umbrella term describing a group of responses to the problem of increased fragmentation of the public sector and an imperative to increase integration, coordination, and capacity. At the core of the whole-of-government approach is the joint cooperation across different governmental agencies and branches. The whole-of-society approach is a form of collaborative governance that emphasizes coordination through normative values and trust-building among a wide variety of actors. Both whole-of-government and whole-of-society approaches are intertwined with each other and mutually complementary. The core of the active health governance is composed of 3 elements: health system, social determinants of health, and lifestyle determinants of health. In recent years, researchers and policymakers have proposed patient-centered care, patient activation, integrated care, community-based care, etc., as the various innovative forms within health system. By carrying out 4 vital functions: service provision, resource generation, financing, and stewardship, the health system aims at achieving 3 fundamental objectives: improving the health of the population they serve, responding to people's expectations, and providing financial protection against the costs of ill health. Social determinants of health and lifestyle determinants of health are the other 2 elements of the core. Among those factors affecting people's health, social determinants of health acts as the predominant role that influences individuals' health behavior through material and psychosocial mechanisms. Lifestyle determinants of health, on the other hand, mainly concerns individual behaviors influenced by social determinants and/or health systems, especially shaped by public health policies. Health system dynamically interacts with social and lifestyle determinants of health. For example, health determinants affect health system performance through a series of public policies, among which the most powerful one includes welfare redistributive policies. Moreover, the health system can improve unbiased access to care and improve the health status of citizens. Investing in health requires investing in the health system and social and lifestyle determinants by using the lifespan or life course approach. Strategies for intervention to health inequalities and social determinants can be adapted to cater for the most important stages of the lifespan or life course, such as the following. First, maternal and child health. It requires not only a promotion of excellent healthcare in prenatal, perinatal, and postnatal periods, but also a broad range of social policies and universal access to primary and secondary school provision. Second, the second stage includes healthy adults. Material deprivations from unemployment or low-paid work and feelings of unfair pay in organizations with high levels of wage disparity contribute to physical and mental ill health. Occupational position is important for people's social status and social identity, and threats of job instability affect health and well-being. Third, the third stage includes healthy older people. Healthy aging requires managing the development of chronic morbidity and improving survival and well-being through health systems.